10 NCLEX prioritization questions with rationals coming right up. So if you're new here, I'm the Nursing Student Avenger. This is my new channel here on YouTube. So please subscribe. So we're going to do 10 NCLEX questions today. So we're going to go to questions starting question 11 to 20. We have answered questions 1 and 10 in the last video. So if you want to look at that, uh, you can go back to my YouTube channel and I have a playlist in there. And so as usual, I'm going to have 30 seconds on my cell phone, and then we're going to start revealing the correct answers. So our question number 11, a patient with autonomic dysreflexia with a blood pressure of 110 over 8, bounding headache, of course, diaparesis above the level of injury and bradycardia. After raising the head of the bed, what should the nurse do first? So I have the timer running. I said 30 seconds. I hope I didn't say 30 minutes, but 30 seconds. And I think you need at least 30 seconds to read the choices. And then I'm going to reveal the correct answer and then explain why it is the correct answer. And so if you can study along with us, get a piece of paper or just have it in your mind for your correct answers. And then at the end, we'll figure out, okay, how many of us got the most answers. Okay, so in this particular question, the correct answer is checking the urinary catheter for kinks or obstruction. So why is that the correct answer? So remember, it's asking for the second thing you need to do because it says after raising the head of the bed. So raising the head of the bed is a priority for autonomic dysreflexia patient. And the reason why is we want to lower that blood pressure quickly, right? But after that, what's the next step? So the correct answer is letter A because urinary catheter kinks or obstructed urinary catheter is actually the common cause of autonomic dysreflexia. So that's the next thing you need to do. Choice letter B is incorrect, although it sounds kind of like good to provide cooling blanket because the patient is diaphoretic, but that's not gonna resolve the condition, which is trying to figure out what's causing the problem. Limiting fluid intake will definitely not gonna be a good idea at this stage, although we're concerned that the Foley catheter is kinked and we don't want to give more fluids in it. But the word limiting is not a good option. And definitely letter D is definitely incorrect. So remember, massaging it can actually cause skin friction, and that skin friction can also trigger the sympathetic response because the reason why we have autonomic dysreflexia is because of a sympathetic response. So letter A is the correct answer. So let's go to question number 12. A patient 24 hours after bowel surgery becomes restless and confused. These are the vital signs. Temperature of 102, heart rate of 132, blood pressure of 84 over 50, and a respiratory rate of 28. Which action is a priority at this stage? So this is a bowel surgery resection. So it's a big major surgery and it's post-op day 1. So timer is running. Please subscribe to this channel. If you're studying for NCLEX and you need resources, I'll put a link to my resources, NCLEX Cram, in the description. Okay, so time is up. So what did you guys choose? A, B, C, or D? And so the correct answer is going to be letter A. So let's take a look at this. This is post-op, sorry. This is post-op day number 1, right? And this is a bowel surgery, which is a very big surgery. So major surgery, right? I'm pretty sure this patient, because of this clinical presentation, the patient is probably is going to be in ICU at this stage, right? And so what do you think is happening? Well, the patient is probably going to septic shock at early stage, because of the clinical. The patient is already having fever, that heart rate is really high, and then with that high heart rate, you have a blood pressure of 84/50 and a respiratory rate of 28. The patient is decompensating at this time, and because it's a bowel surgery, the risk of septic shock is really there. So in terms of sepsis, the first thing that you really need to do is to provide fluid resuscitation. And that's the reason why letter A is the correct answer. Now, letter B sounds good because the temperature is really high, but that's not a priority at this stage. I mean, you can actually, the other priority would be administration of antibiotic because this person is already having some sort of a sepsis, right? Placing the patient in a Trendelenburg position is actually uh, a bad idea at this time, right? So Trendelenburg is that meaning to say the head is lower than the rest of the body, and we don't want to pull all those blood towards the head of the patient. And then reassessing 15 minutes later is what is an incorrect because that's what we call delayed care, right? So NCLEX really wants you to do immediately something right now, right? And NCLEX is kind of like a perfect world. It's not something like, okay, what if this is happening? So when you're taking your NCLEX exam, don't think of it like that. Think that NCLEX is always going to be in a perfect world, which we know is not right in reality. But okay, so question number 13. So this is our third question for today. So let's look at it. The nurse reviews post-operative prescriptions for a patient 4 hours after transsphenoidal hypopysectomy. Which prescription should the nurse clarify first? So transsphenoidal hypopysectomy, again, is another major surgery. And just the word hypophycectomy is going to tell you what kind of procedure that is, and it's done transpenoidally, so it's towards the nose. It's done towards the nose. So what is your answer? Which prescription should the nurse clarify first, right? So this is where it's very important to understand the procedure. So first, let's look at the question. It says, which prescription should we clarify first? In other words, which order do you want to question, especially when you have transsphenoidal hypopysectomy? So the word hypopysectomy, what do you think is that surgery? Hypothesis, right? Hypothesis is pituitary, right? Pituitary. So it's the pituitary gland. And instead of going through the head, they go transsphenoidally, meaning to say towards the nose, right? So that's what they're doing, right? So the patient has surgery on the pituitary gland, yeah, and but they went through the transsphenoidal approach. So what is the thing post-operatively that you really need to know about this? So the correct answer here, the order that or the prescription that the nurse should question first, in my question it says clarify first, is letter D. And the reason why is when you do sip through a straw, you increase pressure, and you don't want to have that pressure, especially in the head area, right? So that's the reason why D is the correct answer. Um, letter A is actually the best thing to do as a nurse. You need to check for the nasal dressing to make sure that you assess for bleeding, right? Of course. And then, of course, the other thing you have to assess is for the presence of CSF, right? Now, letter B is also incorrect because that's not really a priority. It's expected that they're going to have some sort of a headache 4 hours after the procedure, and that's not really a priority. Although we continue assessing that because we want to make sure it's not an ICP scenario. Monitoring intake and output, it's a normal post-operative, or it's a routine post-operative care for any type of surgery anyway. So you monitor INO sometimes frequently. Instead of just 4 hours, you monitor it every hour. But in this scenario, it says 4 hours. That's fine. It's 4 hours after surgery. Okay. So that's question number 13. I hope several of you got the correct answer, letter D. And comment that in the comment section. Is it because, are you familiar with the, I guess, the procedure? Okay, so question number 14. The charge nurse is making assignments. Which patient is most appropriate for the LPN? Oh, I just saw letter C in there. So sorry about the letter C, but it's A, B, C. C is towards here. Okay. And then this is T. Okay. 30 seconds is ticking. Again, good morning, good afternoon, good evening, wherever you're watching. Please, if you could subscribe to this channel, because I do provide high yield contents, and I say legit contents here on YouTube. Okay, so what do you think is the answer for this? Which one can you delegate to an LPN? If you chose letter C, like I said, I'm sorry, I put it on that side. That would be the correct answer, right? Um, and the reason why, because this does not require some sort of a lot of assessment, a lot of interventions and stuff like that. Letter A is definitely incorrect because it says 30-minute patient is had chest pain, right? And perhaps still having chest pain, and the patient is just waiting for troponin level, right? So we need to constantly monitor that. A patient 2 hours after bronchoscopy with new onset of stridor. That's the word new is a kicker there, but it doesn't matter whether it didn't say the word new. If it says stridor, what does stridor means to us? When you have stridor, you have an upper airway obstruction, right? So that's still a concern, even though there's there's new the word new in the answer. The word stridor is already going to tell you that, okay, now I need to watch for this, right? Watch for this too. And then letter D, patient with DKA who has an insulin infusion, because we need constant monitoring on that, right? So just in case the question is, which is the priority between the four, let's say the question is a prioritization question. So you prioritize. The correct answer is going to be letter B, right? Because guess what? Our A, B, C. I know letter C is having chest pain. It can go. We're still waiting for the results, right? But letter B is going to be your priority because of A, B, C. Remember, stridor is an upper airway obstruction, right? Okay. Question number 15. Let's go. The nurse receives hand-off on 4 patients. Which patient should the nurse assess first? But I have the timer here. I try to find a timer that has a sound. Still can't find it, y'all, because I want to put it in my cell phone. But as you can see, I'm very new here, and I don't have those fancy thing that a lot of creator here on YouTube are using. I'm gonna learn. Okay, there you go. Can you hear that? There you go. So which one did you choose? A, B, C, or D? Patient with cirrhosis who has a new confusion is asteresis. So there are two answers here that are like, man, they're really the priority. But which one do you think is going to crash fastest? This is where when you have at least two or three that really looks like they're going to be my priority, but which one is going to crash faster here, right? The one that's going to crash very, very fast is this person. The fact that the patient has chest tube, there is a potential that it's either some sort of a cardiac or thoracic conditions, right? Um, if it's the chest tube and the fact that it's saying serous sanguinous, so there is blood, so that just gives you an idea that this is probably a post-surgical patient, right? I know letter A, this is keywords over here, the word new confusion. The patient is cirrhotic, right? A patient has liver cirrhosis. Every now and then you're going to expect that on and off because of the level of what? What do you think is the concern here? The level of ammonia, right? Right? And because if the patient has liver cirrhosis, that's gonna come and go, right? That's gonna have that. Now you're gonna have the word new confusion seems to be a very concern, but which one of the two between A and C that's gonna crash quickly is gonna be somebody that's bleeding already, and it says 200. So this is the kicker here: 200 ml in the last hour, right? So this patient will definitely do, there should be a invasive procedure done right now to figure out what's causing the bleeding. Like I said, just looking at the choices, it says chest tube, serosanguinous to bright red. You know that the patient probably had surgery when this is after this is happening or before, and then this is what's happening, right? So I said letter A is incorrect. Letter B is also incorrect because that's expected. So always remember that. And letter D is incorrect because cramping is expected for ulcerative colitis. Okay. How many you got? How many of you got letter C? Okay. Okay. Let's go to question 16. A patient with newly inserted tracheostomy becomes restless and has loud pitch respiration, right? The oxygen saturation is 86. What should the nurse do first? So what should the nurse do first? Always remember our nursing process, okay? Always remember our nursing process. Because three of the choices are definitely going to be good answers, but so what NCLEX wants you to do is perform A, D, add pi first, right? That's their rule. Sorry, that's kind of their rule, right? So based on that, what is the one that you want to do first? So if you look at that process, it starts with letter A, and A stands for assessment, right? So guess what? The correct answer is reposition it. You have to assess whether the tracheostomy is patent or not. And then that's the time you do a couple of things, right? After you assess, this is the next thing you do: suction the tracheostomy. If you find that there is secretions in there. If you feel like it dislodged and you don't know how to do anything or put it back, then you call for help, right? This one would not be a good answer, right? The patient is already restless, and depending on a tracheostomy to breathe, you don't want to knock their respiration at this stage. So letter D is the correct answer. Okay? Okay, so let's go to question 17. The nurse notes these findings during a morning round. Which findings should the nurse report first? You need to say report to the provider. Let me get that 30 seconds countdown. So is it A, B, C, or D? A, B, C, or D? Again, two options here that are potentially correct, but one is the one that would require you to do to report quickly to a provider. Okay, so which one? Sure, you're looking at these findings. Which one would you call first, right? So the correct answer is going to be letter A. I know there is a potentially that letter C is the first one to call, but remember, just having a gastric residual of 180 does not really like, oh, something is wrong there, right? So what do we do there? We have to reassess that gastric residual first, right? So we have to do the aspiration again, do it again, see if it's still 180, right? But letter A, this is a lab results. And this one, what do you think it's telling us? If the patient is in anoxaparin, what do you think it's telling us if their platelet count is already on the 52, right? And the things that you're thinking about, I always miss that. The things that you're thinking about is HIT, right? Heparin-induced thrombocytopenia. That's a concern because guess what's going to happen to the patient, right? There is an increased risk of bleeding at this time, right? So that's why that's the priority. That's the first thing you have to report. And then you do letter C, right? If you have these four patients, right? The last thing you need, the next thing you need to do is letter B. It's a little high. The patient is perhaps it didn't say anything whether the patient is diabetic or not. So that's another thing, right? If this is a non-diabetic patient and the prednisone is given, that's high, although that's expected, right? Prednisone or steroid can cause hyperglycemia. This one is also expected, right? Patients who have chronic kidney disease tend to have a anemia, right? Due to decreased production of I don't even know to spell it, poietin, right? Decreased level. Okay. Question 18. A patient receiving blood transfusion refers chills, dyspnea, flank pain. Place the order of actions or place the nursing actions in order. Okay. Number one, stop the infusion. Number two, maintain IV access with normal saline using new tubing. Number three, assess vital signs. Number four, notify the provider and blood bank. Okay. So which one are you going to first and put them in order? What is your answer? So my timer is running. See what your answer is. And then start eliminating those answers that are very obviously incorrect. Okay. So to tackle this type of question, the first thing we need to know what's the first thing to do. And everybody would definitely see stop the transfusion, right? So select an answer that has number one as the first thing, and anything that doesn't have that as the first intervention is definitely an incorrect answer. So you know B and D are definitely out of the game, right? We're not going to select that. Now we just have to select whether we're going to do A or C. Which one do you think is the think like a nurse? Think like a nurse here. So what would you do that would be quicker, right? So if you think as a nurse, the best answer is definitely C. Okay, so let me explain this. Why C and why not A? Well, A is gonna take a little bit, right? The first thing you need to do is stop. And what do? When you go to the patient's room and you see this, the first thing you do is stop transfusion. The next thing you usually do is start assessing the patient, right? You start taking the vital signs, you start monitoring oxygen saturation, and then that's the next thing you do is to change the IV tubing and then call the provider and the lab. Not the other way around, right? Right? So letter C is the correct answer. Okay, question number 19. Which discharge patient should the nurse call back first after hearing the voicemail messages? A, B, C, or D? Timer is running. 15 seconds. 5 more seconds. Time is up. Okay. Which did you choose? B is the correct answer because it's giving us lithium toxicity, right? That's giving us lithium toxicity. So why is A incorrect? That would be a little bit scratchy after surgery. It's an expected potential finding. My pain medication is making me constipated. The side effects of opioids is constipation, right? So there is a tendency that the pain medication was given is an opioid. And then patients taking ferrous sulfate saying my stool is darker than usual, which is unexpected with iron supplementation, right? So B is the correct answer. And the last question for this series is which task is appropriate for the nurse to delegate to the UAP, unlicensed assisted personnel? Is it A? Is it B? Is it C? Or is it D? So something that nurses have to do and something that we could delegate to a UAP. Time is up. The one that we could delegate is definitely letter B, right? And the other key word in there is this word. It says stable, right? That tells you like that, right? This one would require assessment from us. So that's why it's incorrect. This is health teaching or instruction. And this one, again, assessment from us. So B is the correct answer. So that's the end of our 10 questions, prioritization questions for today. So comment in the comment section, how much did you get or what was it? I hope you learned something. Okay. I'm gonna go back really, really fast to the main. Thank you for watching and subscribe to this new YouTube channel. You guys have a good day or good night.